decided to come to another session, and today I'm going to be talking about going to support groups on social media in order to find answers for your cure in your healthcare problems. Now, I'm going to be very specific with erectile dysfunction, but I am going to be talking in general about individuals that I've seen that go to these support groups and start asking questions. So, the story is that somebody goes to an erectile dysfunction support group and they state, I have erectile dysfunction, what can I do? And then that's all the information they give. Well, then there's 50 different responses and comments. Some of them are selling, some of them marketing, some say call me. And in those comments, there are treatments and solutions. And there's good advice and bad advice. Yeah, it's great. The issue that I have is that you really shouldn't be going to a support group for treatment. You should go to a support group for support. You should be asking questions about specific types of treatment. You should be getting advice on what other people have experienced when they had this particular healthcare issue. That to me makes perfect sense, because then you're going to have a very direct question and you're going to get very direct answers. And you're going to get advice on being able to manage and make great healthcare decisions. You will be able to compare holistic ideas against American Medical Association. You'll be able to combine different types of treatments. You'll be able to really seek out and understand what it is that you're really looking for. And that in itself is fabulous. Some of the things are that I've seen on these social media platforms is that the person that's asking the question hasn't been diagnosed or tested. Well, how can you possibly ask a question and get moral support and emotional support and mental support when you don't even know if you have the disease? I remember a long time ago in a faraway land there was a book or magazine that came out regularly called The Reader's Digest, and I worked in a hospital, and it was just amazing that I subscribed to that particular periodical, and when I would read an article in that, I then would recognize that there was a spike in those types of tests. And I just thought it was absolutely humorous, because people weren't really making good decisions on their health care. They weren't getting the type of information that they needed. And the other part about it is that there are definitely individuals on those platforms that are seeking vulnerable individuals in order to sell products and services. And I have a problem with that. Yes, I am on those social media platforms and I do sell no products but services. And I feel that what I am providing for individuals is simply good quality advice that allows them to make good healthcare decisions. We need to be well aware of what our lifestyle is. We need to understand that we're not going to jump off the bridge if we don't have a diagnosis. Education is great. Education and information is really where we need to be investing our time and money. And then once we have that information, we should test drive it in these various support groups, and then really find out what on the internet that we've read is real and what is not. We need to be able to also filter what our healthcare providers are actually telling us, because there are some healthcare providers that are not aware of alternate types of solutions for different diseases and disease states. We need to be able to discuss alternative and holistic approaches towards our healthcare needs. With that type of information, then we have the ability to make absolutely great decisions. One of the tests that I did in order to find out how effective this group was in order to provide treatments, I was on an erectile support group, And I asked the question, have you found any information in this group that has helped you with your erectile dysfunction? And I got no answers. I got no comments. So, if you're going to be going on to these pages and asking these questions, then ghost. Are you in fear of being cured? Do you like the diseases that you have? If you go to a physician and they give you certain treatments, do you want to be cured? The other day, I was getting some services, some cosmetic services, and I noticed that the individual was a diabetic. And what happened was, is we had a conversation about diabetes. They'd had it for type 2 for approximately 10 years, but they weren't paying attention to any of the suggestions and treatments or cures. And so they were going to have a bad time, in my opinion. They could have been cured. Well, I've just discussed a lot of really pain points, so let you comment or give me a call, and I'll be glad to discuss with you the various types of holistic solutions that are out there that will complement your lifestyle. I look forward to talking to you. You have a great day.